vital signs, including the patient's temperature, pulse rate, respiration rate, and blood pressure. This data is used as the baseline data of the patient when entering or being admitted to the hospital. So first, we need to assess the patient. Assess any clinical signs and symptoms affecting the vital signs. Assess the site most appropriate for measurement of vital signs. Assess the factor that may alter the vital signs and assess the skin and mucous membrane color. And this one is the most important. Assess the position appropriate for the procedure. You need to know what position the patient is most comfortable of. And assess the activity tolerance. If the patient can sit down, he or she may sit down. But if the patient cannot, he can just lie on his or her bed. Assess chest pain. So, you need to assess if there are any, if the patient is feeling uncomfortable. Assess dyspnea. So, you need to know if the patient is breathing normally or she is suffering from a dyspnea. Assess the signs and symptoms of hypertension or hypotension. So, you need to know if the patient is currently nervous or anxious. So, tell them that there is nothing to be afraid of. So, the hypertension might be prevented. Next, assess the factors affecting the blood pressure. Determine the policies and procedure for the facility. You need to know what to do and when to do it. Determine the client's record for medications that may increase or decrease the vital signs. So, you need to know if the patient is currently taking medication that may alter the vital signs that you are taking. Planning. Assemble the necessary equipment and supplies. Thermometer, sheet or cover, disposable gloves if necessary, tissue wipes or cotton balls, watch with second hand or indicator, stethoscope, blood pressure cuff of the appropriate size, and spigonometer. Good day, ma'am. My name is Bernadette Jacosa from NDST, your student nurse from 7 a.m. to 3 p.m. So, may I know your name, ma'am?
Lorraine Santos po.
Okay po, Miss Lorraine. So, ngayon po, ang gagawin po natin is kukuhanin ko po kayo ng vital signs para po ma-record natin and para po malaman natin if may nagbago sa inyo or if nag-improve po yung condition nyo. Okay po, ma'am. Mag-start na po ako. Paayos na lang po na ako po. Okay po. So, ngayon po ma'am, magsisimula na po ako. Una po, kukunin ko po muna yung temperature nyo. So, bago natin kuhanin yung temperature ng pasyente, linisin muna natin yung thermometer from the tip to the body. Yan. Then, discard the cotton ball. After that, hanapin natin yung appropriate site para kuhanan ng temperature ng patient. Okay, ma'am. Taas na lang po. Ipit na lang po. Then, after you put the thermometer under the axillary of the patient, wait for the right amount of time to get the right temperature. lang. Ayan, isa po. So, ito. Normal naman po. Then, record the temperature of the patient. After that, get another clean cotton ball, then clean the thermometer from tip to bottom. Then, put the thermometer in its cover. Okay po. So, ang susunod ko naman pong kukunin, ma'am, is your pulse rate po. Meron po ng isang kamay. So, when obtaining the pulse rate of the patient, kailangan nating piliin kung saan tayo madadalian kumuha ng pulse rate. So, sa posisyon na to ng patient, mas madadalian tayo sa kanyang radial pulse. So, kapag naramdaman nyo na yung pulse ng patient, bilangin yung pulso niya under 1 whole minute. Okay. And after that, record the pulse rate of the patient and compute its volume and pressure. So, yun po, ma'am, ang kukunin ko sa inyo is respiration rate. So, kung nakikita nyo na binibilang din ng patient, tsaka pinipigilan ng patient yung paghinga niya, mas maganda yung technique na, kunyari, kinukuha na ni patient ng radial, ng pulse rate, and then place his or her hand across his chest para maramdaman nyo yung respiration niya. Tsaka yung respiration is one inhalation and next exhalation is a one full respiration. So, bilangin natin. Dali niya, ibabay kamay niyo. Kaya rin nun, i-record natin yung respiration rate of the patient, and then while recording it, you must take note of the depth, character of the respiration of the patient. Okay, ma'am. So, ngayon po, ang kukunin ko sa inyo is your blood pressure. So, mag-ayos na lang po tayo po. Pakiplat po yung paa sa sahig. And, yan lang po ng sleeves. Taas naman po yung kamay. So, sa adult, kailangan yung pagpa-place ng cup is above 1 cm in the antecubital area. Pulse rate. And close the knob. Go take the video of the client. Then record the BP of the client. Thank you for your cooperation po, and babalitaan ko na lang po kayo sa result ng vital signs niya. Okay po. Okay po ma'am, thank you po sa cooperation nyo. Salamat po. Thank you po. Evaluation and documentation. Document the data you get from the patient, his or her vital signs. Included the temperature, pulse rate, respiration rate, and the blood pressure. Report any abnormal result to the primary care provider. Lastly, document the procedure in the patient's record.